Now, we're just admitting our colleagues. There's 309 at the moment. So welcome everybody. We'll just wait a moment while everybody joins us. There's over 300 people waiting, so it's just going to take a minute to get everybody into the room. It's lovely to see you all this evening. This is so exciting. It feels like we're connected even though we're all apart, that whole together but apart. Okay. So, 31 people have entered the waiting room. I'm just going to admit all. So now, who do I need to make host? Audrey, will you, I need to make Audrey host. I should have done that beforehand so that she can let people in. Can you make her host? Thank you very much. That's great. Okay. Welcome everybody. Give me 1 second and I'll bring up our presentation for this evening. Now, and our presentation view. So, welcome colleagues. It is really lovely to have you here this evening with us. We currently have 360 people with us, and there are 14 more in the waiting room who are just coming in bits and pieces, and my colleagues from the Institute will be admitting them over the next few minutes. Can everybody hear me okay? Alicia, can you hear me? Yeah.
Yes, we can hear you fine.
So today we're going to be doing our webinar on infection control and community pharmacy during COVID-19. And what I will say to you is, I know it's very small there, but the date actually is important. 13th of May today, Wednesday, 13th of May. The information that we're giving you this evening is correct as of this moment in time. And our colleagues will be explaining to us where we're at. But obviously this is an evolving situation. So guidelines will change. So anybody who's listening to this retrospectively, just be aware of that you'll be looking at it and listening to it at a different point in time. And therefore, some things may change. Some quick domestics before we get started. I'm sure we're all getting familiar with the etiquette now of online meetings. So our microphones need to be muted. Only those who are providing information this evening will be unmuting them. It's great to have videos on and it's nice to see people and be able to scroll through. You can do that in the evening. However, if you're experiencing any problems with connectivity, it usually is made better by turning your video off. If there's any difficulty with your sound, just make sure that your speaker isn't muted or that you haven't got your computer or your phone turned down. And if neither of those work, try logging off and logging on again. It generally seems to help things, and one of my colleagues will be able to admit you from the waiting room. With so many people, we're currently at 380. With so many people on the call, we aren't going to necessarily be able to have the level of interaction that we might like. But so we won't necessarily do that using microphones. But what we will do is ask you to use the comments box for questions or comments. So if you look at the bottom of your screen, at least it's on the bottom of mine, you can see a something that says, I think it's comments. Alicia, can you tell us where that is? Because I'm
yes, so there's a chat little option.
Okay. I don't see chat right now, but I'm sure I'll be able to get it in a minute. So there's a chat function. Feel free to use that. Alicia will be looking at it and sending through comments throughout the evening. This is being recorded. This webinar is being recorded for a number of reasons. One, for colleagues who aren't able to make this evening, but who would like to hear the content, they will be able to look at it because it will be on the internet. And also we do share some of the information that is shared on the webinar. So this morning I was with the HSC and some of my pharmacy colleagues in the Pharmacy Contingency Planning Group and sharing some of the feedback from last week's webinar. So, you know, that information is relayed to other interested stakeholders in a very general, no identification, and it's an anonymized version, but I do let you need to know that that does happen. Now, I am really delighted to introduce tonight's panel. We're going to be speaking about infection control and community pharmacy during COVID-19. We have with us Marie Philbin, who's the Chief Pharmacist of Antimicrobial Resistance and Infection Control in the HSE. Ciara Kirk, the Clinical Lead Medication Safety in the HSE. And then we've got three of our peer network who are pharmacy colleagues and community colleagues given this evening's topic. So Claire Fitzell is one of our peer support pharmacists and professional services pharmacists with the Irish Pharmacy Union. Emily Kelly is also one of our peer support pharmacists and has been working with us for a number of years also, and she's the superintendent pharmacist in Macaulay's. And then last but not least, we have Louisa Power, who is also working in our peer network, and she's primary care pharmacist with the HSE. So thank you all for joining us, and we'll come to you in a moment to hear your thoughts on the evening. I also have with me this evening the wonderful Alicia O'Dwyer. She's going to be trying to keep track of the comments and feeding through to us anything that you need to say, comment on, or ask during the conversation. So thank you, Alicia, for your support in bringing this together, and indeed to the IIOP team in general. They've been really working well to get the information together for these evenings. So the format of the evening, we're going to talk a little bit about what do we want to know out of it, and then have a presentation and some conversation. We heard a couple of things from last week's webinar that you really enjoyed. You enjoyed that it finished on time, so we're going to be done by 9. You enjoyed that there was interaction and conversation, so we're going to involve that. And also you liked the interactivity. You liked being able to discuss things in the chat box, but also have the Menti. So for those who aren't listening and in real time, who are listening to a recording, I'm just going to make the point again, this is evolving information. It will change over time. The recommendation on masks, on distancing, all of those have changed as we've become more and more familiar with the virus. So just please bear that in mind. Alicia, would you mind muting everybody there for a second? Thanks.
Yeah.
So what I'm going to do is ask you to, who do we have with us here this evening? And this is just for us all to know who's in the room. It's very different when we're here virtually, but I'm going to put up a poll. I'm launching it now. So for people who are looking at this in retrospectively, you won't necessarily see the poll, but for the colleagues who are with us this evening, I'm just asking you to give us an idea of where you're working. So community, hospital, academia, industry, regulatory affairs, or other. We may have some non-pharmacists or colleagues from different countries. Because I know a few have contacted me through Twitter asking. I'd also know, and we don't have it here, I should have, and I'm very sorry, we have some of our 5th year pharmacists on placement. Am I right, Alicia? Our colleagues who are out. Yes, our Appel placement students, or experiential learning placement pharmacists. So a very special welcome to you, actually. This is the first time we've opened our webinars to people who are in training. So you're very, very welcome. And I apologize for the fact that I don't have your own little section here, but if you can just indicate what area of practice you're in, that would be lovely. Okay, so in terms of ending the poll, you should see the results coming up with you now. And not surprisingly, the majority of you this evening are working in community. That's what the webinar is aimed at, so that's okay. We have, so welcome to our community colleagues. Hospital colleagues, there's 14 of you. You're very welcome as well. Those working in academia, industry, regulatory affairs and administration, you're very, very welcome. Our 2 non-pharmacists, you're very welcome. And then the 10 others, we don't know as much about you, but welcome as well. Okay, so that's who we have with us this evening. I'm going to stop sharing those results. And the next thing is I am going to do, as I did last week, we've decided we're going to keep this active because we got a lot of rich information last week. So for those of you who are familiar with it, you know what to do. If you have a mobile device or even opening your another tab on your browser, if you can go to the website menti.com, MENTI.com, and use the code that's there. And what I'd like you to do is just take a moment, just for a second, to stop and think, how are you feeling? So what I'm asking you is, how are you tonight? I'm going to stop sharing this screen and I'm going to share the screen as we all start to develop the word cloud. Alicia, is that working?
Yes, that's working for me. Yep.
Brilliant. Let me just get the word cloud. So this is what's happening in real time. Welcome to those I've just left in. We now have 410 people on the webinar. You're welcome, all of you who didn't maybe meet the very beginning. So this isn't too dissimilar to last week, in fact. Tired. Tired was the main emotion last week. But I am seeing relaxed, a lot more predominant than last week, and I'm very pleased to see optimistic. That was there last week, but maybe not as big. So what happens here, folks, is as you put in your one word, the size of the word in the word cloud indicates the number of times it has occurred. So the fact that tired is there in the center means that, you know, quite a lot of you have entered the word tired. Exhausted is there as well, which would be in the same category. There's some people feeling anxious, overwhelmed, but pretty good. Some optimistic, interested. Okay, I'm hearing somebody's TV. So maybe if you can mute all again, Alicia, every so often, that's great. All right, so I suppose the reason we do this is just to connect with our own feelings, connect with the profession, know that we're not alone. And whilst there are some, you know, obviously tired, exhausted, busy, overwhelmed feelings, there's also feelings of happiness, of hopeful. Somebody has written, how long will this go on for? If we're talking about the webinar, we'll be done by 9. If we're talking about COVID, don't know. Okay, so I'm going to stop that share and I'm going to go back to the presentation. All right. So what do we want to get out of this evening? Rather than asking everybody individually, what we did do is we asked you to submit your questions in advance so that we could prepare the best possible experience for you. So I'm going to ask Alicia, because we got a lot of questions and a lot of information that you want. So what I'm going to do is first, Alicia, go to you and ask you if you can summarize for us types of questions people are asking. And then I'm going to go to the 3 pharmacy colleagues that we have on the call, and they'll be able to briefly introduce themselves and actually say what sort of things that they want. And the reason we're doing this, I know some people might think, oh, will she just start with the presentation already? Actually, you know, it's really good to stop and think, what do we need to get out of this? It's like CPD. What are we going to cover? And if you see that up front and you know exactly what we're going to be able to answer, it gives you a lot more confidence that this is going to be a good use of your time. So for those of you who like to just get in and get started, please bear with me. This will be a good use of our time, but let's just think about what do we want to know. So Alicia, can I ask you to let me know.
Thanks, Katrina. So as you mentioned, we did receive quite a lot of questions, and thank you very much for submitting your questions, everybody. A lot of the questions tended to be about the use of personal protective equipment in pharmacies. So we had questions asking about masks, the use of gloves, visors. People also want to know about physical barriers in community pharmacy and the role of the physical barriers and physical distancing in pharmacies. There's also many questions relating to recommended cleaning procedures. But overall, it is quite clear that the colleagues that we have joining us tonight, that what you really want to know this evening is the best way that you can help to make sure that you can protect your staff and protect yourselves while also looking after all your patients and your customers.
Wonderful. Thank you very much, Alicia. Claire, can I go to you, please? You're working as the professional service pharmacist in the IPU, so I'm sure you have a good insight into what a lot of our community colleagues and IPU members are asking about. Can we unmute Claire?
Yeah, Claire shouldn't be muted.
Can you hear me now?
Yes, we can hear you.
Good evening to everyone and to my colleagues out there. It's great to see so many people online for this important presentation tonight and discussion. I'm really looking forward to listening to Mary and Kira, and I think it's a really opportune time given that we're due to see restrictions being lifted in the in the external world. So we may see an increase in people coming to our pharmacies, customers coming to our pharmacies, patients coming to our pharmacies. So it's a really good time to consolidate the learning and all the information that's been sent out over the last 2 months for our colleagues. I am, I suppose, particularly proud of our profession and how they've showed up in the last 2 months, and the agility and their way they have managed in what has been stressful at times. And my colleagues and myself in the IPU have had quite a number of questions. I think that the guidance that we have sent out is available for everyone on our website, and for those who aren't members of our IPU, we have made most of our COVID resources available on the external facing side of our website, so you're more than welcome to look at them. But the queries mainly relate to the fact that each one of our pharmacies are different. Each one of our pharmacists working in our pharmacies are different. So whilst there's guidelines and there's good guidance out there, it's hard to contextualize that guidance to you, your particular pharmacy, your particular unique occasion. So I'm really looking forward to the next probably 45 minutes now at this stage, discussion around how we take those guidance and then contextualize it to our own pharmacy and to ourselves.
Wonderful, Claire. Thanks very much. Emily, would you have anything different, or are you looking at similar?
Yeah, Katrina, probably something very similar. I think by the end of tonight, what I'd love is that you were, to have clarity on all the infection prevention control measures and confidence in them, because I think, as you say, things are changing so much. Sometimes you feel, oh, I'm very sure what I'm doing, I know what I'm at, and something happens that just throws you, and you're wondering then again. For example, in one of our pharmacies yesterday, a colleague from a smaller pharmacy where they have to wear masks because they're not able to social distance arrived into a larger pharmacy where they have the space to social distance, and she started saying, oh my God, none of you are wearing masks, you should all be wearing masks. And then the supervising pharmacist was, should we be wearing masks, should we not be wearing masks? And a confusion can happen, and you wonder, even though you're previously you were sure, yes, we can social distance, we're able to do this, we only wear the mask when or with it less than 2 meters from each other. Sometimes you see something else happening in another pharmacy and you start to wonder and query yourself and lose your own confidence. So I think by the end of tonight, it'd be great to have clarity on everything and confidence in that we're doing the right things.
Brilliant. Thank you very much, Emily. And Louisa, can I go to you to get your insights as to the sorts of queries you're hearing in the primary care setting?
So very much to echo what Claire and Emily have said, there is so much documentation and so much guidance coming from different sources to pharmacies in relation to COVID, the HPSC, the PSI, and from ourselves in the HSE. It is so difficult to then apply the guidance to the individual pharmacy environment that you're working in. And I suppose in all my roles to date, I've seen that as being one of the biggest challenges when providers were required to implement standards or guidance in their individual services. But it can be done, and it's through presentations like this that the information will, be able to assist pharmacists in doing this. And I suppose one of the key things for me is that as pharmacists, we're called on now more than ever to show leadership both in our communities and in our workplace. And it's so important that pharmacists act as leaders and role models in the area of infection prevention and control. Many of our pharmacy colleagues look up to us for guidance and support, and it's absolutely vital that we ensure that our pharmacy colleagues understand the importance of adhering to all good infection prevention and control practices, both inside and outside the work environment, to protect everyone. And the information tonight will hopefully help us in being those types of role models. I really understand how difficult this is, but now is the time to continue being steadfast, determined and committed to the cause. Morale amongst our pharmacy teams may be wavering, but as pharmacists we need to do our level best to redouble our efforts and to steady the ship for the journey ahead. And hopefully the information tonight will give us the confidence to move forward for that journey.
Wonderful. Okay, so I can't see the comment box, but I'm presuming, Alicia, some of that is resonating with people? Oh, Alicia is muted. Sorry, we'll unmute you. Oh, okay. Look, I think that sets a very good scene. I know Mari and Kira are aware of a lot of these. We fed through a lot of the queries to them. And without further ado, I think the best thing really to do is to hand over to our colleagues, and how wonderful to be joined by colleagues, pharmacists who are working in the HSE in the centre of where all this is happening. So I think in the interest of time, Mari, can we pass over to you and just get started?
Great. Thank you very much, Katrina, and thank you all for the introduction. Can everyone see my screen okay?
Yep.
Okay. So well, thank you all for attending in such great numbers. It's a pleasure to present to you all. So how I want to start this is really a little bit different. I want to start with the principle of first do no harm. And I think what I'm going to cover in this slide is what I've experienced since the first of this start of the pandemic, really. You're just overwhelmed with the level of information that is out there, the advice, the daily updates, the hourly updates, the opinions, the literature. PubMed is flooded with publications, and now we're seeing all these preprints that have not made their way to full publication, and so we're just bombarded with all of this stuff. And then everybody is an expert as well. So your mother's an expert, your colleagues at work are experts, the staff in your pharmacy, and everybody has that opinion. And really what I want to say, you're not alone in that. Even though I'm part of the National Antimicrobial Resistance and Infection Control team, all individually and collectively, we've experienced this as well. And what I'll say to you is to try to remain objective in this and follow through on what is proven to work, and avoid, despite all that pressure from all these so-called experts, try to avoid succumbing to that pressure of introducing possibly additional hazards. And examples that I'd like to use here are, say, that new fancy disinfection system that somebody is proposing to introduce to your pharmacy that's going to spray the entire inside of the pharmacy, or that specialized piece of PPE that maybe not quite required for your particular work setting, that maybe for a more specialized procedure within the hospital or intensive care setting, there could be complicated procedure in donning and doffing this equipment, and if it's used incorrectly, that could actually further increase a hazard. And in terms of the disinfection I've referred to, say in terms of hazard to your staff, maybe skin issues, etc. So it's important to avoid it. We're working in a difficult situation as it is, and we don't want to introduce any further additional hazards. What we want to do is focus on the key infection prevention and control principles that we know work. We need to bring it back to the basics, use the key measures that work really well, and try and maintain those to as high a standard as possible, and constantly referring back to them. I mean, the media are doing a really good job in constantly reminding us of this, and I think maybe we just need to open our ears. We might have come a little bit deaf to some of these messages, and we need to open our ears and hear those messages again and focus back, bring it back to the key measures. And I've introduced this slide at the start because I really want to maintain your focus for the next few slides. While you think, oh, that's kind of basic run-of-the-mill stuff, kind of know that already, but it's really to ensure that you're doing those key measures absolutely right, and then that I can empower you by the end of this session to maintain the highest standard and promote and provide the highest standard of this infection control practice within your own pharmacies. So we'll talk a little bit about the virus. I think the virus itself doesn't need any introduction at this stage, but just to say, SARS-CoV-2 is the virus itself. It's a single-strand envelope RNA virus, and then the disease that's caused by the virus is referred to as COVID-19. And just to say at this point, there's currently no evidence that any mutations of it so far have had any effect on the disease characteristic. I've included this slide here just to talk a little bit about transmission and how the virus is transmitted. The virus has a lipid coat with protein spikes, and these spikes, when they come in contact with the mucosa of the respiratory tract, they adhere to receptors there and go on to cause disease. So it can be spread by direct spread. So possibly that person that comes into your space with active infection and coughs and sneezes all over you and transmits the environment directly into your mucosa, so be it the eyes, nose or mouth. You can also experience it by indirect contact, come into it via indirect contact via contaminated surfaces. So via your hands and your fingers touching the contaminated surfaces. So your contaminated hands then are going to touch your eyes, your nose, or your mouth. And I have the statistics there for you, which you can read. We touch our hand, we touch our face, we touch our nose, we touch our eyes, our mouth quite a lot in a 1 hour period. So there is that risk. So the hand hygiene is really important. There is an aspect of airborne transmission with this virus, but again, that's more to do with aerosol generating procedures, which would be procedures that would be carried out, say, in the hospital. So it's not something that you need to take account of in the community pharmacy setting. Talking a little bit about the disease now. Sorry, now I just need to. Talking a little bit about the disease. So from the time that you're exposed to the virus to it actually causing disease within an individual is averaging out currently at about 5 to 6 days. Now that can range from between 1 and 14 days. Individuals are most infectious, despite what we're reading in the literature, individuals are most infectious around the time when they become symptomatic. There seems to be higher levels of virus detected in people that have more severe illness than those that have experienced milder versions of the disease. It is accepted that infection can spread from people before they develop the symptoms, and that's what we read as the pre-symptomatic transmission. But it's not quite clear yet really how much that is actually contributing to the overall spread. Just a little point of note in terms of the virus, it's been recovered on culture up to 8 days. The testing that's being used is a PCR test, and that is extremely sensitive. So when you hear about patients that have had the disease, you know, a couple of weeks later coming up positive again, what it is, it's parts of the virus that's detected by the PCR. It's not the actual what shall I say, complete infected virus. It's just a part of it. So it's not shed, the person is not shedding infective virus. It's just parts that they're expelling. So that's one of the reasons that we wouldn't advocate for repeated testing. So after 8 days, there's no reason to test. Based on the information that I've presented to you here is what the public health would use in their contact tracing definitions. So the infectious period is defined as 48 hours before symptoms until the patient is no longer symptomatic. I've included here a slide with some of the signs and symptoms, which I'm not going to go through, and some of the more less common symptoms, but also to say to you that some of the presentations just don't fit the classical symptoms at all. I've heard of a patient in the last few days who presented with one single symptom, and that was the pseudo chilblains that you might have read about.
Okay. Can I, if I could stop you there for 1 second, Mari, just to see then the implications for some of these, for some of our community colleagues. Claire, you know, with respect to some of the information that's been delivered there, what are the implications in community pharmacy that you can think of?
I think a clear implication is, and we'll be talking about later, which is the requirement, if you can't socially distance, to wear masks. And I know we all are quite clear in the fact that that colleagues shouldn't turn up for work if they're feeling unwell or if they have temperatures or any of the symptoms, but it's that asymptomatic and prior to being symptomatic bit, and I think that's really quite important when we talk about the masks later on. And I know myself and Emily always still look at that picture and how many times we touch our face, and even in this presentation because I'm conscious of my picture being up, I've touched my face at least 6 times, so we really do touch our faces an awful lot, and it's always good to remind ourselves of that fact.
Yeah. I have to say that, Claire, I think like the not touching your face is so difficult. And I think, Mari, that slide where you show the COVID symbol, and there's so much information on that slide that often you have to look so many different places to get it. It's great to have it on one slide, but the touching your face, sometimes I think as pharmacists what we're doing now is a job we did so subconsciously before, that now we're doing it and we have to think about, there's so much change, and then on top of it then you have to think about not touching your face, keeping all the hand hygiene and the social distancing. So it's actually quite difficult to do every day.
Yeah, even if we can go back to that slide just for a second, I think if you can do that, Mari, I think, yeah, this is the one you were talking about, Emily, is it?
Yeah, I just think there's so much there that's really important and interesting and great to get it on one slide, but that it sounds so easy, not touch your face, and working in such a changed environment. You know, we've health mail now, everything is, our interaction, our communications with customers, everything has changed so much. And then so it's like being a pre-reg again on your first day in one sense, and trying to do that in this tense environment while remembering all the hygiene on top of it as well.
Okay.
It's hard to remember everything.
Yeah. One of the questions, Mari, is can the virus be spread directly without coughing or sneezing?
Absolutely, and there is some evidence in the literature that even if you're talking, so particles of saliva, it can be transmitted via that way, and that was NPHET's decision in introducing the masks for the individuals in healthcare that cannot maintain that 2 meters for more than 15 minutes.
Okay, thank you. Sorry for interrupting you there. I'm just conscious as well. Yeah, so you were at the signs and symptoms.
So we were talking about the signs and symptoms, and I've included a slide of those atypical symptoms that are more common in the elderly or the vulnerable populations. And again, what clinician colleagues have described to me, often these patients that could potentially be missed as a case of COVID, is they're just not right. Now, again, that's very difficult to manage that, you know, and how do you define and notice these patients almost, but it's just they're not that right, just not right, maybe loss of appetite, increased confusion. And again, I have also heard of a couple of patients that have actually presented to emergency departments with broken bones because of falls, and they have they were cases of COVID-19 as well. So it's just to bear that in mind and almost to think outside the box, especially with the elderly and the vulnerable population.
Okay.
So how can we protect then? What I'd like to, I think it transitions quite nice into protecting all of these vulnerable and the elderly. We really need to focus now on breaking those transmission pathways.
Now, somebody is asking there, Mari, if they can see some of the slides again. So what I'm going to say to everybody is we'll make all the slides available and the recording afterwards. So you'll have all that information that Mari has so concisely put together for us. So yeah, don't worry about that.
Okay, so just one point I'd like to make before we get into the nitty-gritty of the key infection prevention and control measures is to emphasize the point again that we can easily be distracted by the attention that's afforded to PPE. So there's been a huge amount of information in the media or by whatever means. PPE is only one part of the process. It's absolutely a vital role in some situations. So in that patient in intensive care that's been intubated, you know, there's the potential for aerosols to be generated there, and PPE has a key role in that process. But without all of the other measures, PPE is useless. The infection prevention and control process as a whole is what is important in interrupting the transmission of this virus. So over the course of the next few slides, what I'm going to focus on again is those key measures and continuously emphasizing them. So the frequent hand washing, the cleaning the common surfaces regularly, avoid touching the eyes, nose and mouth. And again, I'm sure somebody has a clicker on me to see how many times I'm doing it. The respiratory hygiene and etiquette, and the physical distancing.
Okay, so just going to some of our pharmacists, how is that playing out, either Louisa or Claire, when you're going around to pharmacies? How are pharmacists finding this? Louisa?
Well, I suppose a lot of it is that we know this, and we know about the frequent hand washing, and we know about cleaning, and we know about avoiding touching our eyes, nose and mouth, and we know about the respiratory hygiene and the physical distancing. But a lot of it is around showing leadership and ensuring that as pharmacists we are constantly explaining to our pharmacy colleagues and also to the greater public and reminding them. And I suppose there's quite good signage available on the HSE website. If people aren't aware of that, it's really, really important. It's very, very good. It's very, very simple. It's in plain English. So it's really, really important to make sure that, as pharmacists, we're reinforcing this all the time, not just within our workforce, but also with the greater, wider public as people are coming in,
Can I ask a question that's come through on the text box, which is, somebody is saying, I believe that in the community setting, good hand hygiene and hygiene practices, and above all, social distancing, and not allowing patients into the pharmacy is key. Is that something that you're seeing people do, or is that the advice?
I suppose it depends, Katrina, on the individual pharmacy. If you're not able to maintain the physical distancing of 2 meters in a small pharmacy, maybe the only option would be that you would have to have a table or a hatch at the door. But then in the larger pharmacies, you may be able to have the physical distancing, and I'm sure Emily will be able to give us some guidance around how she's managing that, I suppose, in her work.
Oh, Emily, sorry.
Sorry, I suppose, Louisa, yeah, we've lots of different size pharmacies, but the majority of our pharmacies, we are able to have customers in, and have done from the very beginning. We found putting physical markings on the floor was the best way of showing patients where to stand and how to physically see the 2 meter markings, and that really worked well for allowing access to the pharmacy.
Okay.
I might just add in something,
Yeah.
Katrina. Today that we sent out with our updates a risk assessment guide for people to use in community pharmacy, and the idea behind that is that people can go through in a systematic way all the areas, and it includes these common things in the pharmacy to understand actually what's the right risks, where have I put in the right measures, what additional measures can I put in place to give them the confidence that, and actually part of this presentation tonight, to give them the confidence that actually perhaps I can now open my door. I have got everything I need in place. I have everything together, and I now feel in a more confident place to be able to do that.
Okay. And you mentioned to me earlier, it may not still be the case, but that there was some confusion between 1 meter and 2 meter distances. Is that still the case?
I think, and it's back to your evolving situation. At the start, there was guidance given out, but that was a 1 meter, and then it went to 2. And because of the timeline, some of the guidance documents still contain that 1 meter measure. And I think and Mary can correct me if I'm wrong, but we can now assume everywhere where it says 1 meter, it is now 2 meters. And it's just to give people confidence that where they read 1 meter, it is now 2 meters.
Absolutely, Claire, and that was again one of the NPHET decisions. So you'll even see it in the video that we're going to show on hand washing on the next slide. Because it was prepared at the start of the pandemic, the distance that's mentioned in it is 1 meter, but please bear in mind that has moved to 2 meters. So I think we'll move on to the slide on hand washing, if that's okay.
Yeah, perfect.
So again, just to emphasize that be it alcohol-based hand rub or soap and water are equally effective for the hand washing. So again, it just depends on what situation you are in and what is easier for you at that point in time. In general, in our guidance, kind of pre-pandemic, our alcohol concentrations would be advised as 70 to 85%. I know at the start of the pandemic, with the issues with supply, a lot of the product seemed to be around the 60%, which again is fine. And I suppose to reassure you, there is literature to support concentrations of alcohol down as far as 30% being effective against the SARS-CoV-2 virus. But again, I would slightly caution at those much lower concentrations, because obviously it's not just SARS-CoV-2 that we're dealing with, and we have to bear that in mind. There's a lot of other microbes going around, and especially coming into the winter season. So it is up on the higher concentrations that we would recommend, but just to reassure you that the lower concentrations have been shown to be effective. So it's a relatively easy virus to kill. So just before we go ahead with the video, just to say that this is delivered by my colleague, Professor Martin Cormacan, who is the HSE clinical lead for antimicrobial resistance and infection control. And you may well have seen Martin, be it on the Late Late Show or particular HSE briefings. And he's featured on lots of radio calls. This video as well nicely incorporates the respiratory etiquette and the physical distancing. And again, just to bear in mind that the 1 meter is gone to 2 meters. So if we can go with the video, is that okay?
Absolutely, no problem. So everybody can see that?
Yep.
And hear it though.
No volume.
No volume.
Turn on your speaker then.
Okay. 1 second. No volume.
No, we still can't hear it.
Okay, that's fine. Well then,
well, you know what? I think it's fine without the volume, because again, it's the visual. I think it's the visual that's most important in this, and the technique of the hand washing.
Okay, so with that in mind, I'll just go back and get your slide, because I had, I'm almost tempted, because there's so much to go through tonight, to say that people could look at it themselves. But
well, absolutely,
you know what? I'll try. No, let's do it, and I'll try and put my earpiece up to the screen. So just go here to. Sorry about that, folks.
What you want to do is you want to wet all the surfaces of your hands, up and down to clean the palm of your hands. In the back of the hands, clean. And you notice I'm cleaning between the fingers as well. Then make sure you get the finger webs, and then interlace the hands to clean the fingertips on both sides. And then it's thumb on one hand, thumb on the other hand, and then clean the palm of your hand. And that's the single most important thing that we can do in healthcare to reduce the risk of getting any one of a number of infections that we might be exposed to. And then if somebody looks like they have acute respiratory illness, other things we can do. Right? Out a meter or 3 foot away from the person if you can, most of the time, because that's where the sneeze and cough drops are going to fall, is within 3 feet or a meter of the person. So try to keep away from them. And also, if they're in a waiting area, try to make sure that they're sitting about that distance, about a meter or 3 foot away from anybody else. That helps to reduce the risk. Another thing that you can do to reduce the risk of getting in contact with respiratory viruses at work is to make sure that the patient has tissues that they can use to cover their nose or mouth if they have to cough or sneeze. So if they cough or sneeze and they cover their nose or their mouth, that's going to catch most of the virus from the droplets, and then they can put it into the bin, and that's what we call cough or respiratory etiquette. And then if there are no tissues available, try to encourage the patient, or for ourselves as well indeed, is to use the elbow, not the hand. Because if you cough into your hand, if you cover your mouth and nose with your hand, what you've done is you've put virus all over the palm of your hand. And then everything you touch, everybody you shake hands with, you're spreading there's a risk that you spread the virus to them. So if you don't have a tissue, it's sleeve and elbow, not into the palm of your hands. So for the latest information on managing the risk of infection, and in particular the coronavirus that we're concerned about at the moment, if you check out the HPSC website, you'll get the most up-to-date information there. Thank you.
Did you hear that?
Yeah.
Yes, we could hear bits of it
Right.
towards
Sorry.
the end.
Okay, so I've stopped sharing there, and if you want to take it over.
Yep.
Mary,
Great.
I suppose there's been a few comments in the comment box, and again, it's something that comes up quite a lot in my work, is around the use of gloves and the appropriate use of gloves, I suppose, in the pharmacy.
Thank you, Louisa. So this is a message that we are really trying to get out from our team, is to avoid the use of gloves. We do not recommend gloves. Gloves have a very important role to play, again, in the more, say, specialised procedures within the hospital, where possibly a sterile procedure has to be undertaken, or where there is, say, significant risk of contact with bodily fluids. So again, in the community setting, out and about, we would not recommend the use of gloves, because gloves are designed to be a single, for a single task, and it's important that the hand hygiene is done before putting on the gloves, while the gloves are on, and after taking the gloves off. If the gloves are contaminated, there's a very big risk when you're taking off the gloves, if it's not done correctly, that you will contaminate the hands. And again, it gives you this false sense of reassurance that your hands are clean, when in fact they're actually heavily contaminated. And we feel so strongly about this in the AMRIC team. It was our key message for the press release for World Hand Hygiene Day on the 5th of May that has just passed.
Brilliant. Okay.
So on this slide, I've just included a little bit of information about the survival of the SARS-CoV-2 on various surfaces as an introduction to cleaning. And the literature that we have on that, I have stated the various hours that it survives on the particular surfaces. But just to maintain a note of caution there, because this was experimental studies. So what is this, in transferring to the real world? So yes, it's 4 hours copper, 24 hours cardboard. And again, the authors in the paper advised caution with this, that there was a lot of what they called noise surrounding the cardboard data. So just to bear that in mind. They compared in this paper the SARS-CoV-2 to the SARS-CoV-1. And based on their data, there was very little difference in terms of the environmental viability between the two viruses. So their conclusion was that really the greater transmissibility of the SARS-CoV-2 that we're seeing does not seem to be related to the environmental viability. And again, just at this point to emphasize the ECDC advice, and particularly relevant to the community pharmacy setting, is the incoming of packages in terms of logistics, retail, etc., that they're not at any greater risk, and there's no special measures required in the management of these deliveries.
Ari, that's really interesting, because I know there was some fit guidance around disinfecting the totes before they come into the pharmacy, so that's really reassuring to hear that the ECDC is not saying there's any special measures needed for packages coming into the pharmacy.
Absolutely, and we would be of that opinion in AMRIC as well, that there's no requirement. And again, it comes back to, Emily, what I said earlier, is to avoid introducing extra work when it's not needed. We're working in difficult situations as it is, and we have to be very mindful that we're not introducing unnecessary procedures.
That's great, thanks, Mary.
Mari, could I just ask a quick question there that's come up a few times now in the comments in relation to patients handing in prescriptions, and is there any special precaution in relation to the virus maybe surviving on that piece of paper?
Again, as far as I'm aware, in the literature, there's been nothing on paper, but if anybody is aware of it, and again, because it's quite hard to keep on top of all this literature, please send it in to me, and we can have a look at that. But I'm not aware of anything on paper. And again, it's all about the assessing the risk of the situation. So again, if everybody is playing their part, so if healthcare workers that are writing these prescriptions are carrying out their hand hygiene as we're recommending, and again, the patients that are bringing it, and we have data among the team and from the Department of Health that members of the public have increased their hand washing significantly. So we have to bear that in mind as well. So again, I'd reassure you and say that I wouldn't have any worries with regards to this. And if I recall correctly, I think the ECDC also have a similar statement like they have in terms of the deliveries that are referred to. I'm almost sure they have a statement in terms of paper as well.
Brilliant. Thanks very much, Mari. Now, I'm very conscious that there's 10 minutes left and our commitment is that we're going to let people go by 9. So one of the topics we really do need to get to is masks. Would you be able to go through the next couple of slides, just top line, and we'll be providing them to people, Mari, but just to kind of pull out the key points, and then we'll go over to Ciara.
So
Thanks.
just in terms of the cleaning, your standard bleach solution, a dilution of 1 in 50 is absolutely fine. And just to emphasize to frequently clean those frequently touched surfaces. We can't define for you how to do that, because that will depend in terms of the frequency. Depend on your level of activity, number of staff, number of customers, etc. We've talked about some of the physical distancing options that are available to people within their own individual pharmacies, so I'm not going to delay any further. What I will say on what's my last slide is to make sure, and as Martin would have referred to in his video, to make sure that there's tissues available for both for staff and for customers, and that there are obviously foot operated bins available then to discard of these tissues immediately. And what I will say really to get to emphasize these key measures within your staff is to do a daily stop and check. So like the World Health Organization have a safe surgery checklist. So surgeons doing their surgery, it's their bread and butter, they do it every day, but before every single surgery, they do their safe surgery checklist. So is it the right patient? Is the right limb marked or whatever? Has the patient had antibiotics if they require it? So I would encourage you maybe to introduce something like this in your own pharmacies, be it a morning, or, you know, if you find that this practice wanes in the afternoon, to consider introducing something like that. So wonderful. Thank you. That's all from me.
Brilliant. Thank you so much, Mari. And you know, you have some fabulous slides there that will be circulating with people. And also, I know there's a commitment that if there's any questions that haven't been addressed, there's an FAQ document being developed by the HSE and the IPU. And also, we'll be very happy to take questions that we can direct to Mari afterwards. But I would love to go now to Ciara. Ciara, you have a bit of a challenge in the sense you have 10 minutes to talk about the big topic of masks. But if maybe you could draw out the main things for us that we need to be aware of with masks, please.
Sure, and just hold a hand up or something if you've any difficulties hearing me.
Nope, perfect.
No, not moving. Okay, so the masks issue, sorry, I think it's moved forward 2 slides. Yeah, so there are 3 types of masks. Sorry, is that? Yeah. So the 3 types of masks are medical masks or surgical masks, so they're the same thing, the respirator masks and cloth masks. So the medical or surgical masks are the type in the picture there, and they are designed in the first place to prevent transmission of infection from the wearer. They also protect from droplet and splash transmission of infection to the wearer. And they are the ones that have been recommended for pharmacy use, and we'll go into that into another bit of detail later. They are also suitable for patient use, so for people who have COVID to use in their homes to prevent transmission to other people in their home if they have to move outside an isolated room. And surgical or medical masks are disposable. The respirator masks, so you will hear maybe FFP2 masks or N95 spoken about, and these are designed to prevent the wearer from inhaling agents, so infective agents if they're airborne as opposed to droplet, but also for other things, so for dust, chemicals in various scenarios. They need to be fit tested, so it's not a one-size-fits-all. Many of them are disposable, but there are also reusable ones available. And in healthcare use, we're really talking about where there are aerosol generating procedures with COVID. And so the use of these masks would be covered by the PPE guidance on the HPSC site. Cloth masks, or I think community masks, they may be known by, and these are designed to prevent transmission of infection to the wearer, from the wearer. They also provide some protection from droplet and splash transmission of infection to the wearer. And they have been proposed by some agencies, including the Centre for Disease Control in the States, and others, to provide population protection. And the reason for using these is so as not to compete with supplies that are needed for healthcare. Obviously, they're not standardized, so they are not prepared up to a standard. You can follow guidance in order to make them to the standards that the CDC are talking about, but obviously the research can't be done to actually determine exactly what protection they will provide. The the NPHET recommendations, which are on the National Public Health Emergency Team, who are really guiding the nation on this, they have recommended that these surgical or medical masks should be worn by healthcare workers, and that includes pharmacy staff. And that's when you're providing care to people and are within 2 meters of that person, regardless of their COVID status. And for when you cannot distance more than 2 meters for periods of 15 meters or more from other healthcare workers in the workplace. So that 15 minutes is a continuous period and not something that you have to calculate over the whole day. But the contact with patients it's any contact within 2 meters. So again, totally secondary to hand hygiene, respiratory etiquette, and physical distancing. So in practice, we're talking about assessing the risks and protections in place with your team in your pharmacy, and using professional judgment as to what the situations are that you're presented with, and when people may need to use masks and for how long. So it's not necessarily the case that people will need to have them on all of the time. It might be that it is only when going to speak to a patient, and when do you not need to use them. In terms of people coming into the pharmacy, as Mary has said, there are other things that you might use, but perhaps at a later stage you may be advising people to put on masks if they're coming in for a procedure where they're going to be there for a period of time. But we aren't there yet. I've included this information, which is probably too much information, but having gone to the great trouble to try to find out the difference between all of the masks, this is shared with you so that you won't have to do the same. The bottom line is the EU standards, type 1 masks are let a tiny bit more bacteria through than type 2 masks. The R means that it's fluid resistant. If they don't have an R, it's not fluid resistant. The ASTM standards, any of those levels are suitable for use. And the key about the European masks, the type 1 masks are to reduce risk of spread of infections in the situation in which we find ourselves now, pandemic situations. The statement is that they're not intended for use by healthcare professionals in an operating room or in other medical settings with similar requirements. So in a pharmacy, type 1 masks are probably appropriate for all or very nearly all situations that you'll be encountering. So to don a mask, so there is a video from Martin Cormican, but we don't have time to show it here. But basically,
yeah, but we'll make it available to people,
yeah.
though, Ciara, so don't worry, and they'll be able to use it from the link there. Yeah.
Yeah. So I think the key to it: hand hygiene first. Stretch the mask this way so that it is stretched, and you apply it to the really top of the bridge of the nose and all the way under the chin. There's a metal band at the top, and press it so that it fits snugly. So they're supposed to be tight on your face. And there are masks with ear loops, and obviously that's how you place it on. And with ties, you're tying on the top of the head. When you're wearing the masks, you're keeping it in place for the entire time that you're wearing that mask. If you have to touch it, that mask has run its course. So you don't touch them, you don't remove them, you don't pop them down on your neck for a while and then put them back up. You don't put them in your pocket. So discard if you have to take it off, if it's wet, if it's dirty, damaged, if you have to take it off to eat or drink, and if you have to take it off to use the phone, or if you're using a shared phone. Taking them back off, again, hand hygiene first. Loosen the ties or the ear loops and discard, holding that straight into the bin, and hand hygiene at the end. There's a lot of hand hygiene these days. There is a poster which can help with that, and that again is available on the HPSC site. And just to highlight again some of the places for the documents, the HPSC site, obviously that's where the pharmacy guidance and the original pharmacy guidance is, and the posters for pharmacies. But there are lots of other questions that you might have. You might find documents in there that may answer them for you. The patient and public information is on hse.ie/coronavirus, and it is very good, and it's updated constantly. So they're really constantly renewing that information. There is guidance and evidence reviews on COVID generally on that website, or if you search HSE COVID repository. And we have the FAQs for pharmacies that the IPU and ourselves developed, and we will update that. So I think if there are questions unanswered by this webinar, we will work with the IP to update that document so that we'll try to answer some of them. There is also information available on HSE Land. I'll probably continue with this. So on HSE, it's the HSE Learning and Development site. And if you register as volunteer, which is just to be used at the moment, there are infection control resources and lots of other resources on the site at the moment, and including some of the videos that you might need, particularly if you want to show them to staff in the pharmacy. That could be useful. And also on this website, there are other posters and resources that may be of use.
Fantastic, thank you. So I'm really conscious that I want to make sure that we get to the end of the evening quickly, but at the same time, I hate having this cut short. So what I'd say is thank you very much for that, Ciara. That's really, really helpful. Not sure what I'm sharing right now, but I'm supposed to be sharing the end slides. So I don't know if you can see these.
Yes, we can see
yeah,
your
you can
final
see
slide.
it's not going into the slide share for some reason. So what I'd like to say is there's a lot of information there. I'm sorry that we've had to cut it short towards the end, although I think all the information is there, and we will be sharing them with everybody who's on the call. How amazing to see over 440 people on the call, and most of them here to the end, although a couple of people just had to leave there at 9. I'd like to extend a very special thank you to Mari, Ciara, Claire, Emily, Louisa, to everybody who's on the call. to Alicia and the team in the IAOP. And I will commit to you that we'll take the questions that haven't been answered. We couldn't answer all of them, and we will circulate the information, as I know our colleagues in the IPU and the HSC are also doing so. So we'll make sure the information gets to you some way. I'm not going to let the opportunity go by with saying have a think about how this will impact on your practice tomorrow. And what I'd like to do is invite you finally to our next week's webinar, which will be leading teams during COVID. So perhaps we're having difficulties in engaging all of our staff in all of the different provisions, and it's a tough time for them, and how you ensure that you keep a cohesive team and work with them will be something that we'll be talking about next week. So on that note, I would just finally like to say a very special thank you to all of you for giving up your evening, for being here with us. And I wish you a very pleasant evening, and we look forward to hearing your feedback. We'll be asking you to give us feedback on how you found this evening in an email. We'll also be giving you the recording and the presentation, and if there's anything else you need to talk to us about, you know where we are, just give us a shout. Thank you to the presenters. Thank you
Katrina, sorry, I just realized I forgot to say something about masks, which I would like to share with people. So we are pursuing with the HSE whether supplies could be arranged, and the process to try to get that approval is underway, and the approval isn't guaranteed, but we are hopeful that it will be. So I hope that will be positive information, and we'll definitely be in touch absolutely as soon as that proceeds further, because it would be, I think, very helpful if that was possible.
Thank you, Ciara. What a wonderful way to end the evening. So yeah, that's a high note to go with. So hopefully we'll see that progress. And I know Philip Crowley has committed to, he feels that, and indeed our colleagues in the HSE very much feel that we should be dealt with parity on our other healthcare professional colleagues. And so hopefully you'll have positive news for us on that front, Ciara. Thank you very much. Okay, good evening, everybody. As we did last week, we'll stay around for a little while. It's kind of like that end of the evening when people kind of mull around before they go home. You're very welcome to leave. Just walk out. It doesn't look as abrupt as it does in person, and you all have busy things to do. But if there's anybody who wants to ask any other questions or just stay for a couple of minutes, by all means, feel free to do so. So thank you, ladies. Sorry, Mari and Ciara, it was just a lot of information to get through.
That's all right.
Yeah. So Louisa, Emily, Claire, do you feel we got the main things addressed that community colleagues will be thinking about? Start with you, Emily. Yeah, go on, Louisa.
I think so, Katrina. Like, there's a lot of questions that have come up, I think, in the chat box, particularly around flu vaccination, that probably we don't have any clarity on yet. But I suppose it's just maybe something to you know, that's on people's minds, I think, at the moment, you know. But I think a lot of things were addressed. You could see questions coming in and then they were being answered, so which is always good, you know.
Okay, yeah, and I do think we'll get more clarity in the coming days with the NIO on flu vaccinations. So yeah, that'll be something I'm sure everybody will be sharing. Emily, do you feel the main points were touched upon?
Yeah, and I think looking at the feedback in the box there, that it's like people are saying excellent, and I think, yeah, Mari and Ciara were brilliant. Just the detail and the confidence, I think, that you gave Mari, like, because it's all off, you know, you're just so knowledgeable. It really gives you confidence, and as you say, bringing you back to the core important points and not getting distracted by sprays in the air. I thought that was just brilliant.
Very good. And Claire, how about you?
Yeah, no, I think it's great. We can get carried away, I think, and just to bring it back to the basics, and then there's confidence that actually, if I'm getting the basics right, I am in control, and actually I'm in a good place when it comes to managing my pharmacy, my team, and the risk for my customers and my colleagues.
And I think the big message is every pharmacy premises is different and will have different requirements, and that takes I suppose a level of making a judgment on the size and how closely staff are forced to work together, or if you have the luxury of lots of spaces of workstations, that's a different matter. So unfortunately there isn't one size fits all, but I do think it's great that the IPU have those resources freely available to everybody, that the HSE have them available, that they will be good sources of contemporaneous information that will stay up to date and current, because I think part of the difficulty here is that it's moving so fast, people can miss guidance, and as somebody rightfully said at the very beginning, it's just so hard to keep on top of all the guidance, as well as keep life in general. You go home then and you're trying to homeschool, and you just think, oh Lord, it's a lot. It's a lot.
Well, I think it's one aspect of running a pharmacy business, which, you know, has added an extra layer onto what is already a busy job. So
yeah.
And it's just, you know, trying to keep on top of everything is difficult.
And what's interesting about pharmacists is we've all been trained to do aseptics. We have pharmacists who work in aseptic units with their laminar flow cabinets. We all know very well from college days what you need to do in a manufacturing plant. So typically as pharmacists, we can do this excellently. It's just that there hasn't been a need before this to do it, to think about it in pharmacy. And I know from the Royal College of Surgeons, our medical students will get this sort of training very, very early on, because it's just part and parcel of what they do, but it isn't necessarily been something that any of us have had to deal with in community, and I say community in the broadest sense and community in general. So it's very strange now to be going into a shopping centre or to a shop to get your groceries and to see people wearing masks and having your perspex screens, and you know, so this is something that's affecting everybody, but I think people look to pharmacists as being leaders in healthcare, and there's a huge pride. I have a huge pride for pharmacy. We're the one profession who stayed open through it all, and I think that really needs to start getting recognised, and I think it is. I think it really is being recognised.
I think, Mary, my two big takeaways were two things you said. The one, the stop and check, I thought that was brilliant. And the other one was just what you said, like about we're so busy anyway, don't be introducing more complications. I just thought that really, sometimes we just get so complicated. I thought that was a great point. I'll definitely take that away with me.
Absolutely, and that's one of the things I think we're so lucky to have Professor Cormacan as the clinical lead in this area, because he is a very, very practical, sensible head on him, and it's all about doing what works, that we know what works, and again, as I say, and as you mention again, Emily, is not to introduce things that we don't know whether they do work or they don't work, and if they introduce an extra hazard, then you know it's not advisable.
Yeah.
Okay, well, ladies, I know that you've had a hard day's work already, and you're going to be doing it again tomorrow. I know that we've 100 people still on the call. Lovely to see you here, and you know, we need to do one of these where we just do a social drink or something, because it always feels so bad closing down.
I'd be happy to join on that one.
Yeah, we give social distancing, but maybe we just call it a day there. And listen, thank you very much to each of you. So Ciara, Mari, Emily, Louisa and Claire, it really was a very valuable conversation, and hopefully it's given people comfort. So thank you very much, and good evening to everybody.
Good night now.
So
Good night. Bye-bye.
Bye. Bye.
Bye. Thank you. Thank you.
You're welcome. Thank you. I can't seem to, my mouse has disappeared, so I can't even stop it. Hang on, where is it? Oh, for heaven's sake.
Katrina, while you're still there, could I ask one question?
No, yeah, do indeed. How are you?
Good. Now that the weather hopefully will start heating up in the next few weeks, is there any guidance on the use of air conditioning units?
I don't know. Is Mari still gone, or is she's still there? Is she gone?
I think Mari's gone.
Oh, Emily, did you come across this, or Claire, did you come across it at all in your investigations?
I haven't seen guidance on that yet, but Donna, we did commit to anyone who raised a query that we would get an answer for you. So I commit to you that we'll try our best to get an answer for you, and you'll find that update in our frequently asked questions.
Lovely, Claire. Thank you.
My pleasure.
Right. Catherine Morrow, I'm still admitting you. I've admitted you about 50 times. I don't know if you're still on the call or not, but she just kept coming in.
Yeah, she must have been on another link.
Different, yeah. Okay, I found my mouse and it's doing what I've asked it to do now. So listen, thank you very much, colleagues, and we will see you next Wednesday. Bye.
Thanks a million.
Okay.
Bye.
Bye.
Thank you.
Bye.